Again, welcome to the Off to College Not on Your Own class for 2020. Just a quick plug for the College Diabetes Network. So a lot of the information that we're going to be talking about tonight was developed or curated by the College Diabetes Network. This is a great organization that has both great information online and is a really great resource to you as you head off to school. They have chapters at many universities, and it's a great way to network with other students who have diabetes and kind of become connected and build community. So there are also student and parent off to college brochures that you can download. You can request the electronic copy. If you just go to the College Diabetes Network website and then go to their resource hub, it's kind of up at the top of the web page, you can request those off to college brochures, and they're really nice materials. This is sort of a sample of the student guide, and they're just really nicely put together with great information. This is an example of one of the pages that you'll see when you request that information. Also wanted to let you know that if you've registered for this class, you'll be receiving a packet of information in the mail in the coming weeks. So that's going to contain a healthcare power of attorney form. That form you can complete using the directions on the form and then return once you've done it. There's also there's a diabetes information form. That's a form I'll show you here in just a second, but one that our team has put together for you to kind of keep diabetes information together. It also has a place for insurance information. It's a good document to share maybe with roommates or other people who would need to know about things you want to have them know in an emergency, or a place for you to keep track of that information as well. There's also going to be some of our favorite College Diabetes Network handouts. There will also be disability paperwork specific to you and your school. So that information will be in there. We'll also fax a copy to your school. And then there's a UW Health release of information. So since many of you are 18 or will be turning 18, that's something good to get on file so that we can continue to speak with your parents or whoever you want us to be able to talk to now that you're an adult. And then also there will be a copy of our sick day plan in there for your reference. Sorry. The agenda for tonight, we're kind of doing the welcome now. Then Cassie Vanderwall, one of our registered dietitians, will be presenting Eating Well in College. I'll talk a little bit about equipping yourself for success. Dr. Ellen Connor is with us, one of our endocrinologists. She'll give a talk on planning ahead. Then we'll have our Q&A session with the panelists. And at the end of the session, there will be a survey that we'll ask you to fill out just so we can continue to improve this session as we've done over the years. So I'm going to hand it over to Cassie. I real quick just need to make her the presenter. So, all right, Cassie.
Thank you, Whitney. I hope everyone had a good day and the evening is treating you well. Let me make this a little larger here. So what I hope to talk to you about is the transition to college. So taking your healthy eating habits with you to school, or using this as an opportunity to give your habits a facelift. So where we're going in the next 10 minutes, I want to talk to you a little bit about what your own food environment could look like. Review what a balanced meal or smart snack is. Provide some tips for navigating lows in a variety of situations, suggestions for exercising safely, and then how to approach lifestyle change. But before we begin, I think it's really important to start from a platform or a foundation that there really isn't one definition for health or healthy eating. Health could mean being free of illness and disease. It could be an overall well-being. It could be simply being physically able to do what you want to do, or even functioning well with a chronic disease such as diabetes without age-related limitations. Likewise, healthy eating doesn't have a definition either. It's very individualized. And oftentimes we find that people want to put certain diets on certain disease states or diets on certain lifestyles, but that's not the case. It's very individualized to genetics, heritage, culture, social aspects. However, there are some principles that we know that eating safe, quality, nutritious foods can promote health, however you define it, and that good nutrition provides good energy to fuel your lifestyle. We also know that healthy is not a size. It's certainly a lifestyle. It's a compilation of things that we do. And it's not even just our healthy body or our physique. It's actually our healthy mind, our healthy spirit, our healthy soul, which really leads to a happy life. And as we transition, I hope that you take an opportunity to reflect upon not only all that you've done to become where you are today in your academic journey, but also where you've come in terms of your diabetes journey or your health-related journey. Taking a step back and being proud of the fact of how you've managed your disease or how you could manage it in the future. Because most importantly, we believe that health is the real wealth and that not pieces of gold and silver. I believe Mahatma Gandhi said it best when he stated this, because this helps us understand the priority that our health can be. So from there, other priorities that I hope will come as part of healthy eating or on your journey to health would be to achieve optimal physical and cognitive development. That's what we do in our college years, right? People hit the gym, they build their minds, they establish their careers, they think about what they want to be and write that happily ever after. Hopefully part of that is maintaining a healthy weight, enjoying food and maintaining a positive relationship with food, continuing to develop or maintain healthful eating habits as your own person, on your own independently, and participating in regular physical activity that brings you joy and thus is sustainable. So this starts within your environment. So we're going to talk first about the food environment. So what is your food environment? It's simply what you eat, when you eat, where, why, and how. It's all encompassing. We know that what we bring into our dorm or what we bring into this environment will eventually be consumed. But it's deeper than that, right? Because health and healthy eating is more just the food on the table. It's often how we think about that food or how we treat food, our relationship status with food, if you will. So take a catalog of what that would be and which foods will be available to you in your food environment. Are you on a dining plan? Are you going to have kind of those freebies? Are you going to be able to eat whenever you want, or will it be set to the dining room hours? Will you be privileged to be in an apartment and able to cook for yourself? Lots of questions. And how will you build your meals? So the next few slides will talk about what a balanced meal looks like. We know there are basic energy sources, so those macronutrients, carbohydrate, protein, and fat. And we know that our body most readily uses the energy that it gets from carbohydrates. So we've stated carbs are the primary energy source, but protein and fat are just important, and that protein are the building blocks for not only our hormones, but our muscles, our hair, our skin. And they can be a true tool when we're promoting energy balance and blood sugar balance. And the same is true for fat, because fat is powerful in that it can slow digestion and really help to absorb vitamins, specifically our fat-soluble vitamins A, D, E, and K. So when we're building meals, we want to be thoughtful about that. And that's why the plate method or my plate can be really helpful in thinking about kind of the boxes to check when building a meal. So we want to make sure there are some carbs present so that we can make sure we have a vehicle for our insulin. Grains, starchy vegetables, milk, yogurt, fruit, and fruit juices. But we want to make sure that these alone aren't filling our plate. We also want to make sure that we feel confident in counting our carbs, whether it's label reading, using an app such as Calorie King, calculating the carbs in a recipe that we've made homemade, or even seeking out carb information from our dining hall. So take that step to think about as you are crafting your food environment of how you will find information or what tools you will use to set yourself up for success. We also want to make sure that the carbs that we consume consistently are quality, right? We talk often about using whole fruits versus juices and reserving juices to treat lows, because we know that they're really good at bringing our blood sugars up and up quickly and can really make it more difficult to manage our blood sugars throughout the day if we have these quick carbs interspersed. We want to be mindful of our protein choices, going lean with protein, meaning not necessarily lean in fat, total fat, but lean in saturated fat, because solid fats or saturated fats are highly correlated or associated with elevated LDL cholesterol and poor heart health. So being mindful that the proteins that we're consuming often, such as lean beef, skinless chicken, fish, beans, nuts and seeds, or low-fat dairy or dairy alternatives, are lower in saturated fat and prepared in methods. And this can help us to promote heart health too. And then finally, fitting in fats, because as we stated, fat can be a powerful tool in slowing down digestion, promoting satisfaction, and helping to absorb those powerful fat-soluble vitamins. They can also provide balance of the blood sugar as they slow digestion. And these come in a variety of sources, again, nuts and seeds, olives, avocado, hummus, and we want to reach for more of those omega-3s. Now you may be thinking these are not readily available on college campuses, but if we prepare ahead of time, if we think that, ooh, I want these to be a part of my food environment, then they can be. You have that power, you have that control. So we know that brain tissue is made of mostly fat, and gaining weight does not necessarily make you smarter. Just want to fact check here for you all. So that brings us back to this summary slide of how we build a healthy meal. So again, it's not a plate full of carbs, which can be really easy to do, especially when we're in a dining hall with a buffet table. But we have to be careful at making sure that we do reserve space on that plate for vegetables, fruit, dairy, and protein. That will provide more satisfaction and a healthier landscape internally for learning, playing, and working. Oftentimes we find that our college students learn that they don't have time for a meal, right? They have back-to-back classes. Depending on how you've structured your schedule, that might be true for you. And in that case, we want to be just as smart about how we build snacks. And here you'll see that it's important to have at least 2 food groups at a snack. Again, if we just build snacks that are carbohydrate based, such as the list on the left side of your screen indicated with C's, we will continually just be reaching for more and more snacks, not getting the satisfaction that comes from protein and fat. So I would encourage you to peruse these equations and see which ones are best for you. Which are those that you can keep in your backpack, in your bag, in your dining hall, in your dorm room, or elsewhere to make sure that you're prepared and satisfied so that the day doesn't become a fast. And then finally, hydration, equally as important. It's really easy to get stuck in the hustle and bustle of class after class and forget to drink. So continuing to make water your number 1 beverage, choosing nutrient-rich beverages that are low calorie, such as low-fat milk or an assortment of plant-based milks that might be available to you are important. And continuing to limit those high-calorie beverages that can make blood sugar management more difficult. And one of those, of course, is alcohol. So I think we can't have a college class without touching on alcohol. And although it might be a sensitive subject, I think it's important for everyone to know how to drink safely. It is not that we condone underage drinking by any means, but we want to make sure that you leave with the strategies in order to consume alcohol safely. It's really important to monitor your blood sugars closely before, during, and after, and not skipping meals or snacks around alcohol. Making sure that you always wear an ID and that you have notified someone that's hopefully with you that you also have diabetes. Making sure that you stay hydrated while you drink and eating while you drink can help to prevent the hypoglycemia, the low blood sugar that's associated with consuming alcohol. And we get often the question of why does this happen? And it's simply because the liver is the primary source, the primary organ in our body that both detoxifies alcohol, but also helps to manage our blood sugar when it's low. And it prioritizes the detoxification process. So when alcohol is on board, the liver's not paying any attention to what the blood sugar is doing, and therefore it can make it very difficult to treat lows in these circumstances. And of course, we encourage you not to drive or plan to drive for several hours if you do choose to drink alcohol. And these lows you can be at risk for lows for up to 24 hours after you drink. So making sure that you are closely monitoring your blood sugar during this time and making sure that prior to going to bed that you have a safe blood sugar level. Speaking of lows, how do you prevent lows? Well, we prevent lows by following all of the nutrition tips that we've talked about so far. Balanced nutrition, careful selection of carbs, and good matching of insulin with carbohydrates. How do we treat lows? Well, you've probably heard it time after time that it's the rule of 15 and 15. Check your blood sugar, consume 15 grams of quick carbohydrates like that juice we talked about, and then wait those 15 minutes to check your blood sugar again. If it is low, then repeat the cycle until your blood sugar has been restored to normal. Most people also find that once your blood sugar achieves a safe level, to consume something with protein, and that again can help to stabilize your blood sugar and provide satisfaction after you've achieved a safe blood sugar. So what does 15 grams of carb look like? Well, it could be half a cup of juice, so 4 ounces, a quarter cup of raisins, a fruit cup or an applesauce cup, glucose tabs, lifesavers, you name it. I would encourage you to keep a few of these in your dorm room, in your bag, as you may already be doing so, as well as giving your RA or your floor advisor a stash to keep too, because we know it's really easy for food to disappear in a dorm room. Other staples that would be really important to keep on hand for treating lows associated with sick days are juice boxes, low-calorie drinks like G2 or Propel, Jello, again, applesauces and fruit cups, crackers and graham crackers, and peanut butter. Things that we know are easier to digest, shelf-stable, and they're there when you start to feel ill. And please don't forget safe storage for your backup insulin and your keto sticks. Again, you may want to lean into a close friend that you've made or your floor advisor. So most importantly, being prepared by carrying these quick carbs with you, stocking up your dorm room, and always keeping extra money on hand. Also, preventing lows is pretty associated with exercise and activity because we know that intense exercise can be associated with delayed lows. So making sure that when you do fit exercise and physical activity into your day, that you are careful about making sure that your blood sugars are safe in order to do so. And if you're exercising or hope to exercise for the first time in a routine manner, now that you're on your own and you have more freedom in terms of what your schedule looks like, think about your fitness personality or how you enjoy moving. And the goal should be simply to move more. Again, we want to find and establish routines and habits that can support exercise and health throughout the lifetime, not just the next 4 years. So when we start to achieve these lifestyle changes, we recognize that it's never too late to change. You may have had habits for years, but we can make small steps to this transition to school that can lead to really big changes. And this can start with a SMART goal. So something that's specific, measurable, attainable, realistic, and timely. And maybe this is something as simple as I'm going to build in meal times and exercise times into my school schedule. I'm going to pencil these times in for me and my health, making your health a priority just as much as your grades will be. If you're thinking about goals, but not sure where to start, consider 5210. So you might have a plethora of fruits and vegetables available for you, hopefully, in your cafeteria waiting for you. How will you incorporate those? Maybe you really want to make a commitment to drinking more water and giving up juice or soda. That would be the 0 servings of sugar sweetened beverages. Or really focusing on moving more. We know COVID has kept people at home. Screen time has really increased in terms of prevalence and frequency, but maybe you're ready to say, nope, I'm going to convert my screen time to physical activity. Whatever it may be, again, set a SMART goal, find an accountability partner and social support, and achieve it. Oftentimes, if we group changes such as transitions in life to other changes and desires that we want to make, we can be more successful. So recap here. Create your own food environment with this transition and with health in mind and healthy eating in mind, however you define that. I encourage you to build your meals, kind of following the My Plate with 3 food groups and snacks that have 2 food groups to make sure that they're sustainable to you. Be ready and prepared to treat lows and prevent those lows. Find time for exercise and physical activity that you would enjoy and aim for about 60 minutes a day. If that seems out of reach, 30 minutes per day is a great start. And finally, I encourage you to take one thing with you from tonight. May not be something nutrition related, but something else that one of our presenters will say. So take a moment while we consider some questions that you may have for me and tell me, what's that one thing that you can take with you?
Thanks so much, Cassie. If people have questions, feel free to either chat them in the chat box or if you want to unmute and ask.
I'll take the quiet crowd as a compliment that perhaps I answered all their questions. But I want to remind you guys that dietitians are incorporated into the diabetes clinic model. And if you do have questions that you feel are more individualized, please bring those with you next time to your next visit, or even consider my charting them to your provider, your diabetes team, and they can trickle their way to the dietitian on the team too that you usually work with. But I want to thank you for your time.
And Cassie, Ellen did just ask about gluten-free dorm eating. So do you have any comments for people who have
Sure.
gluten-free or other restrictions for eating in their dining hall?
Great question, Dr. Connor. So gluten-free foods are more readily available than they ever have been, simply because of the growing prevalence of celiac disease and people following gluten-free patterns just out of a choice, a lifestyle choice. Excuse me. So I would encourage you to touch base with your food service director. They're often associated with university housing or university dining. Most college dining services have a dietitian. They're all required to do nutrition analyses, and they can make that information more readily available. I know it's different by every campus, but some have designated gluten-free stations. Some have even gone so far to color code. So it would just be reaching out, making sure that you, again, are putting your health first, asking the right people of where the gluten-free food is available. You don't necessarily want to take that all upon yourself and try and hit the grocery store every time you want to eat or keep those foods. They should be able to provide you and accommodate that need.
Excellent. Thank you. Any other questions for Cassie?
Thanks, everyone. I hope you have a great evening.
Thank you. All right, so now I'm going to be speaking about equipping yourself for success. And really, we're going to talk a little bit about just getting prepared and being prepared for going away to school or whatever that looks like for you this year. We're going to talk a little bit about communicating about diabetes, both with your parents or caregivers and also with friends and new people that you'll meet at college. Touch on sick days, a little bit more mention of drinking and diabetes, some information about classes and accommodations, and then a little bit about mental health. So one of the most important things, as you probably already know, right, is being prepared. So we want you to create a plan for your supplies. What supplies do you need to manage your diabetes? Where do those come from now? Who pays for them? Who makes sure that they're coming? When should you expect them? Are they shipped to your local address? Will you be able to pick them up on times when you're home from break? Or will you need to arrange for those supplies to be delivered for you while you're away at school? Think about those things and collaborate with your family or whoever has been helping you obtain those supplies in the past to make sure that you have a plan and that it's a clear plan of who's going to order those things and what will happen. I think as much of, as important as it is to have the original plan, it's also super important to have that backup plan, right? What happens when the shipment is delayed or you and mom or dad didn't communicate and no one ordered the supplies or something like that. So make a backup plan. It's a great idea if you're on a pump to have a long-acting insulin, to make sure that you have plenty of your rapid-acting insulin to put into your pump. Also, maybe have an extra glucometer at school, just one that you only leave maybe in your dorm room or always carry with you. But it's always a great idea to have those supplies just in case the plan A doesn't work out. Also, it's important to think about where you're going to store the supplies. So things that need to be refrigerated, like your extra supply of insulin or other diabetes supplies, how are you going to accommodate those? If you have a refrigerator in your dorm room, it's always a good idea to sort of get a feel for how that refrigerator works. Sometimes those smaller fridges or ones that are maybe a little bit older can get really cold and could freeze your insulin. So you just want to make sure that you're leaving it in a safe place. When and where will you dispose of sharps, right? Make sure that you have a sharps container and a plan for getting rid of those sharps that will keep everyone safe who comes into your room or your area. Also, make sure you have a medical alert bracelet or a necklace. For many people, this didn't seem as important when you were always around people who knew you, but often going off to college or moving out into the working world means that you're around people who don't know you as well, or that you're coming and going a little bit more. So it's important to have a medical alert bracelet or necklace that's clearly identifiable by emergency personnel in case something would happen. Also, it's important to keep your contact information and sick day guidance. So contact information for your clinic, your pharmacy, maybe your pump or other diabetes product supplier ready so that you can find it. And then also keep your sick day guidance at hand, right? So that you can refer to that when you need to. And another way to be prepared is to schedule your appointments in advance. So with our clinic, we allow you to schedule appointments up to a year in advance, and that can be really nice to take advantage of those college breaks. One positive part about all of the changes that are going on right now are that we now have virtual or telehealth visits where we can see you over the phone or through video. We still want to see you at least a few times a year in person, but you can maybe space out your visits a little bit easier or complete those visits from home now that we can offer these virtual appointments. In your packet of information that will come when we mail it to you is going to be this emergency care plan that you can fill out with your information and just store it somewhere safe or store it where your roommate can find it. This has your insulin doses on it, or you can put your insulin doses on it. You can also check the form of glucagon that you're using, indicate where that glucagon is kept, and then put your emergency contact information on it. On the back side, it has our sick day plan and also a place to just put in a little bit more information. So kind of going along with being prepared is gathering supplies and thinking about what do you need to take with you to school. So obviously you need the things that you use day to day, your insulin, your needles or your pen needles or syringes or your insulin pump, your CGM supplies. Those are all kind of obvious. But you also want to make sure that you have plenty of low treatment supplies. So glucose tabs or gel icing and glucagon for those really severe lows. And then also other things that you can use to treat like juice boxes or fruit leather, crackers, sports drinks, those kinds of things. Like Cassie mentioned, sometimes it's easy for these things to disappear in a dorm room. So sometimes a surefire way to always have a low treatment around is to use glucose tabs, right? Because they're a little less appealing to your roommates who might be hungry and looking for something to eat. You also might want to keep some things on hand for if you're having higher blood sugar, so some water bottles or tea or fresh veggies that you can kind of snack on that are lower in carb. Also having your sick day supplies, so having the sick day guidelines, and some people find that it's helpful to store those in a container with some like regular soda or fluids that contain carbs, as well as your ketone strips, so that those are, it's like a sick day kit that you can access when you need it. And then also just keep some snacks and food options in your room for when you're hungry in general. I did want to mention when we were talking about low treatments that there are now multiple glucagon options available. You may be most familiar with the Glucagon Emergency Kit, which is down the first one on the lower left. That has been the most used option in the past, but now there's a Gvoke pre-mixed injectable. So that glucagon doesn't require that you mix it. There's not that step of having to dissolve the pill and then draw it up. It's ready to go, and it comes in either a pre-filled syringe or this hypo pen that's pictured here that works much like an EpiPen. So no one would ever see the needle. They just pull off the red cap and push the yellow end on to administer the glucagon. So it just makes it a lot easier. There's not kind of the fumbling with the glucagon that there has been in the past. And then Baqsimi is also a nasal powder glucagon that can be given and to raise the blood sugar, and it works just as well as the other glucagons. This form requires no mixing, there's no needle, super easy for someone and way less intimidating to do in an emergency. So each form works the same way with the same speed. And then also think about who might need to give you glucagon in an emergency, right? And train those people on how to give it and where you keep that medication so that they would be able to access it easily in an emergency. And then talk them through the steps that they would need to call 911 if they need to use that. Each product has videos and training materials on the internet, or we'd be happy to talk to you about that when you come in for your clinic visit. We also want to talk about communication. So you need to set expectations about sharing information and also know how to share information with those who need it. So are you generating diabetes data? Almost everyone is at this point, right? If you're using a glucometer or a CGM or a pump, you are creating information about your blood sugars. Now is a great time to think about who you want to share it with and how you want to share that information. And if you're sharing it with them, how and when you want to communicate with them about diabetes. When do you want mom or dad to text? When should they call you? When is that okay and when is it not? It's a great thing to kind of establish before you're getting mad at your parents for nagging at you about your blood sugar all the time. College Diabetes Network has some information about this. It's kind of like contracting, right? So as the student, you would agree to do these things, wear a medical ID, take care of yourself in certain ways. And as the caregivers, then they would promise not to maybe, get mad when you have a number that's out of range or something like that. And then, figuring out what can be said, who's going to bring those things up, and when you're going to talk about it is a great idea. Another part of communicating is sharing information with others, so your roommates or friends that you're going to meet. What diabetes information will you share? What do they need to know, and what do you want them to know? You know, good things to talk about are, what is type 1 diabetes? What does it mean for you? What happens if your blood sugar is high? What happens if it's low? What might they need to do to help you? And what are other things that they can consider, or what are other things you want them to know? So sharing this information with your friends, your roommates, RAs, that can be really helpful. And then how do you want this information to be used? You know, making sure that you're clear about that too. So some tips for when you're having the talk is, you know, for some people, humor is a great way to diffuse tension. So use your humor or whatever works for you. Make sure you feel comfortable and confident about the information that you're sharing. You know, this is your information to share, and share it in the way that you want to. I think starting simple and adding details from there can be really helpful for friends so that they're not overwhelmed. And you don't have to tell them everything all at one time, just the most important information. So for sick days, we talked about that sick day kit and keeping your sick day plan on hand at all times. That sick day kit or sick day guidance is going to be in the mailing that we send to you. You also may want to know the location of the closest emergency department, just in case you become ill and need to seek treatment. And then when you're sick, you want to check your blood sugars frequently, drink plenty of fluids, and ensure that you're giving insulin. I think the biggest thing with sick day, right, is if you are not feeling well, don't just check your blood sugar. Make sure you're always checking ketones with that, because a normal blood sugar alone doesn't mean that things are in the clear. So go ahead and follow the sick day plan. If you're ever in doubt, you know, we are still here 24 hours a day to answer those questions to help you get through sick day management. We've talked a little bit about sick day supplies. So something that has carbs, you know, things that are easy on the stomach, so crackers, broths, things that will keep well in a dorm room are nice to have around. Cassie already touched a little bit on drinking and diabetes, and like she said, we in no way are condoning the consumption of alcohol by people who are underage, but we do know that there are opportunities that present themselves at college, so if you choose to drink, you need to understand how to do so safely. So one important thing to know is that having a low blood sugar and being intoxicated can look similar, and so letting your friends know, hey, if I'm not acting like myself, please, you know, ask me if I should check my blood sugar, or help me, you know, get some food, something to help bring my blood sugar up. And it also may, having been consuming alcohol, can reduce your ability to tell when you're low, or to thoroughly think through how to treat a low. So just be aware, if your decision-making is inhibited, that you've kind of had a plan in place for someone to help you take care of yourself. So tips to stay safe. So preventing hypoglycemia, knowing that you're going to need extra snacks or possibly a reduction in insulin doses if you're drinking. We want you to check your blood sugar frequently if you choose to drink. So you can use your CGM as a tool, but also have your glucometer available in case you need it. Know that those lows can last well into the next day. So, you know, be checking your blood sugar more closely, and like Cassie said, perhaps set an alarm if you need to get up to check your blood sugar in the middle of the night, or alert someone to help you with that. We want you to wear that diabetes identification at all times, especially when you're drinking, letting your friends know and having someone who's looking out for you, and then also having plenty of low treatment on hand. And another thing to think about when you're going away to college is registering with your campus disability resource or academic achievement office. That's why we provide the disability paperwork to you, so that you can give it to them. This paperwork is really important, and registering with the office can be important to do ahead of time. So you want to do this before your classes start. You know, just registering with them doesn't mean that you will ever have to use your plan. But in case you are having a sick day on a day of a test, or your blood sugar is out of range and your performance is going to be affected, you want to have this paperwork on file with the disability office, so that you have the protections that you deserve, so that you can perform as well as you need to in your classes. Things that you may also want to think about are technology alarms. So will your CGM or your pump be beeping? How will they handle your cell phone if that's your CGM receiver? You're probably familiar with these things from your high school tests as well. You also want to have the ability to check your blood sugar during lectures, or to have carbs or water during those lecture times. Also taking exams, right? So having those accommodations around when you wouldn't need to take an exam because your blood sugar is out of range. And then if you're sick, to be able to reschedule those. And then mental health. So we know that college is a super exciting time, but all of these changes, and especially with everything that's going on and the way that everything looks different right now, can increase stress, anxiety, and can really impact your mental health. We know almost everyone with diabetes would benefit from speaking to a counselor at some point in their lifetime. And so we want to encourage you to seek support as needed from your parents, from on-campus resources, friends, or your diabetes provider. All right. Are there any questions? I'm going to go ahead and go on to the next slide, but feel free to either interrupt me or to chat questions if you need to. So just wanted to promote the use of MyChart. So it's a great way to stay connected with your healthcare team, even if you're further away or not at home any longer. So MyChart gives you instant access to your medical information. You can sign up for MyChart at uwhealthmychart.org or call the MyChart help desk at the toll-free number shown here, so 877-768-0732, and they can help you get connected with MyChart. All right, and Ellen, give me just a second and I'll make you the presenter. All right, perfect.
Okay, let's see. Almost there. Can you hear me?
Yes, we can hear you.
Okay, I am sharing. Oh, there it is. Okay. Well, welcome everybody and congratulations to all the graduates. Years from now, you'll have the best graduation stories, I think, of anybody. You'll have the most unique memories about this year. I do hope that you're celebrating and that you're proud of yourself and that you're excited about starting your first semester, whatever that's going to look like. I know some of you are going to be going to school in person. Some will be doing a combination of virtual classes online and going to some classes in person. But I hope you'll keep in mind that whatever this year looks like, it's not going to be that for all of your undergraduate years. And I hope that you'll have friendships that get started even this semester that are going to be with you for the rest of your lives. So I get to cover some of the other medical topics that we're today, talking a little bit about planning medical care, and Whitney's already introduced that, so we'll cover some of that. I'll talk a little bit about immunizations, mostly immunizations that everyone should have going off to college, and one in particular that's helpful for people that have type 1 diabetes. We have to talk about COVID-19 because it's the elephant in the room. And I wanted to, give you some information that hopefully will help you with some of your decision making. And then when COVID's over, I hope that you'll be thinking about doing a month or a semester abroad. And I wanted to give you information about that. I'm really happy that John Beckman is one of your panelists tonight because John can give you great information about traveling. I was very proud of the fact that by the time he finished his college career, he had done a lot more traveling than his endocrinologist had ever done. So you'll get to hear from him a little bit later. First of all, to kind of follow up on what Whitney was saying, work on going ahead now and scheduling your visits on breaks. Since we're letting people schedule up to a year in advance, you can schedule your winter break and your summer break if you'd like. The recommendations for somebody that's your age, or someone who's 18 or about to be 18, through the rest of adulthood, is that you check your hemoglobin A1C 2 or 3 times per year. So for somebody that's in good control, if you're not feeling like it would be helpful to see us to discuss anything from a technology standpoint or an emotional and mental health standpoint, you can really get by with 2 diabetes clinic visits a year. If on the other hand, you're having trouble kind of getting your A1C back in a range that you'd like, I'd really encourage you to think about coming and seeing us on fall break or spring break, or, for many of you to do that by video, since we've got that available now. Each of the endocrinologists and the diabetes nurse practitioners is going to have certain days that they're in video and certain days that they are in person. The other thing is that when you're coming for those two or three visits a year, one of them should include your annual labs, including a urine microalbumin to make sure kidney function looks good. One of them should include a foot exam, and it would be good to schedule an eye exam. The timing on the eye exam is changing a little bit. The American Diabetes Association recognizes that with pumps and continuous glucose monitors, and even with taking multiple injections a day, the majority of young people who are starting college don't have any type of complication from diabetes. So the eye exams may actually be changed every 2 years, but it'd be good to get one. If you can't get it in now, try and get it in next summer, and then from there, look to see if the recommendation is once a year or every 2 years from there. One of the other scheduling numbers, I think the one that Whitney gave you is better because it's a 1-800 number, but the local number is 263-6420. And if you call that number tomorrow and ask for extension 3, they can set all your diabetes appointments up for the rest of the year. I would second what Whitney said about MyChart. It is so incredibly helpful when you're in college or grad school because you don't have to wait for somebody to call you back in between classes or, possibly get a phone call when you're in class. The MyChart sign up has gotten much simpler now because of COVID. It's one of the good things that's come out of us doing so many things virtually. The one thing to keep in mind is that it's not something you'd want to use for an emergency. So if you've got vomiting and ketones, call our clinic number, tell the receptionist it's an emergency. And, that would be ketones, vomiting, having a seizure, having a pump that's failed, something along those lines. That's, those sorts of things, somebody should give you a call back quickly. As far as, some other topics we want to talk about, and when we see you in clinic, we want to know what's going on with your life. We really enjoy the summer and winter visits. I'm hearing from the students and, kind of brainstorming with them if they're having trouble fitting in diabetes management into their semester, celebrating with them if, some things have actually gotten easier, talking about semesters that they want to do abroad. That really a lot of planning going into that makes it go very smoothly. And ask us what's new. The rate at which technology is changing, it seems to be going faster and faster over the last few years. And that means that by the time you graduate from college with your bachelor's degree, there are probably going to be several new improvements on what we can offer you in the summer of 2020. Do check in with us and make sure that we've got your labs ordered if you're due for labs. Not only will your on-campus options for counseling be much more than what you had when you were in high school, but we can also help you try to set something up through your insurance, either at home virtually or in whatever city you're going to end up in. And you've got all these changes coming up. You're in the middle of COVID, and then on top of being in the middle of COVID, it's going to be your first semester away or not. Maybe some of you are going to be staying at home. But counseling can really help go a long way to make the whole college experience much more enjoyable and less anxiety provoking, and also to make your day-to-day life a lot more enjoyable. Does anybody have any questions about any of that? Is everybody able to see the slides right now? I got one message that said people couldn't see slides. Are you able to see them now? Or
oh, yep. Yep, we can see the slides. I think your video is not on. So if you want to share that, feel free to. Otherwise, I think we're good.
All right, I'll try and work on that. So the next thing to talk about is immunizations. And let's see if I can get this to, I don't know. Okay, I'm just going to pop out for just a minute so that I can pull up the video. I don't mean to be doing this anonymously. So talking about immunizations, the first one to think about is the influenza vaccine. And from being in clinic all these years that we always bring that up. The important thing to know is that it's going to be available in September. And while we're also dealing with COVID, it might be nice to have the opportunity to get your influenza vaccine early so that it'll start to take effect early. If you've read the list of symptoms that go along with COVID-19, a lot of them sound like symptoms that accompany influenza. And so it's a lot of the campuses are going to offer the influenza vaccine on campus. Some of them actually included, I think University of Minnesota has done so much research on immunizing college students that they sometimes offer it for free. But lots of the colleges will offer it or offer it at a discounted rate. You can get it at a clinic visit. You can get it from Walgreens or CVS or Walmart, one of those pharmacies. The important thing is to go ahead and try and get it early. We know that some people that had COVID got it when they had influenza. So we'd like to try and really make sure that we're leaving as few opportunities for you to have ketones as possible. It will be available mid-September, and it's going to have the strains of influenza that we're seeing in Asia in the summer, because that tends to be what we see in the wintertime. It's going to take about a month for the protection to really build up once you've had it. So think about that it's going to take a little time to act entirely. The other thing is that if there is an inhaled version, that's not recommended for people with diabetes, because the inhaled version, the nasal one, has live influenza virus in it, and that would promote ketones. So that's why we recommend the injection instead. Another vaccine that's recommended for anybody who's going off to college, it's now recommended for all teens usually, usually by the time they start high school, is the meningococcal vaccine. That protects against one type of meningitis that's called meningococcal meningitis. And it also protects against an overwhelming bacterial infection that's called meningococcemia. Both of those are really severe. They have been seen more in large groups of people, so tended to be when someone was living in a dormitory or at a military base or things like that. The Centers for Disease Control now recommends it for everybody. Most of you have probably already had that vaccine. And you can check with your primary care provider to be sure about that. There's an additional meningococcal vaccine that is for strain B, which is not the one that's most common, but there was an outbreak of it at University of Wisconsin just 2 or 3 years ago. And so when that was happening, that vaccine was recommended for students who were on that campus or going to be around that campus. So that's one that you might also look into if there's an outbreak at your school. You can get it ahead of time, or you can get that if it's seen in a place where you're living. The next vaccine is one that's a little bit more specific. Pneumococcal, the pneumococcal vaccine is against a bacteria called Streptococcal pneumoniae, and it causes pneumonia, sinus infection, it can cause ear infections, but it can cause an overwhelming bacterial infection, which we call sepsis. It's just when the bacteria is actually in the bloodstream. And it's more common in certain groups of people. And one of the groups of people is people with diabetes. So it's recommended that everyone who's got type 1 diabetes get the Pneumovax. That's the specific form of the pneumococcal vaccine that's recommended for someone who has type 1 diabetes. Many people have had the other form. The Pneumovax is just a little bit more extensive. So it's worth asking your primary care provider if that's the one that you've already received, or if you need to get the Pneumovax before you head off to school. So that's a good thing to keep in mind. We'll switch gears just a little bit to talk about COVID-19. You've probably been inundated with all the descriptions of what the symptoms are and how some people have really severe disease and some people don't have severe disease. The studies that have come out as recently as this week suggest that people who've got well-controlled type 1 diabetes don't have an increased risk of catching COVID, and you don't have an increased risk for the lung complications. If someone's uncontrolled, or especially if they have type 2 diabetes, then they are at more risk. The thing that's been seen so far in the patients around the world who have developed COVID-19, who had type 1 diabetes, is that they have a high likelihood of developing ketones while they've got COVID-19. And some of them can go on to ketoacidosis. So that's why we're really stressing knowing what your sick day plan is. Basically that that if you don't feel well or you think you might have COVID, even if your blood sugars are perfect, keep checking them. And every 3 hours, give yourself your corrective factor, your correction factor. and keep checking urine for ketones. If the ketones are trace or small, drinking fluids and keeping up with your insulin should help that go away. If they're moderate or large, you may need more insulin. So if you start doing the correction factor and you're not seeing your blood sugars improving or the ketones going away, give us a call because we'll talk about a more specific sick day plan. COVID-19 looks a lot like influenza when it comes to ketones. So we see people every year who have ketoacidosis when they have influenza, and it looks like the same thing is true, or perhaps a little bit more true, if you get COVID-19. That being said, we've had kids who've had it and have not had ketones at all. We've had some who've had COVID-19 and had to be in the hospital for a day or two, not because of the COVID-19 problems, but really just because we needed to get rid of their ketones and get them out of DKA. So it's definitely something, to really pay attention to, but also to know that when the original studies were coming out and talking about increased risk with diabetes, they were talking about type 2 and uncontrolled type 1 with complications. So you can feel better about going to school if you're doing the things that all the rest of us are doing, if you're wearing masks everywhere, and if you're using hand sanitizer and washing with soap and water, that you're not at an increased risk compared to your roommate. Again, if you get COVID-19, talk to your family about it, talk to us about it. Let's have a plan where you're checking your blood glucose and checking ketones, giving insulin every 3 hours. And again, if you start using your sick day plan and the ketones are not decreasing, or they're not going away, or they're going up, then give us a call. To have a couple of these websites, because there's so much out there. There's a lot of nonsense that is out in social media about COVID-19, and some of the websites are, it's kind of hard to sort out what's good and what's not valid. So the CDC has a very good section on COVID-19 on their website right now. That's where the most up-to-date information is placed. And I checked over the weekend, and they actually had the update about type 1 diabetes as compared to type 2. Another one that I guess we're kind of fond of is our uwhealthkids.org website, uwhealthkids.org /type 1 diabetes. There are a lot of things in there about technology and about apps for your phone, but there's also a really good section on diabetes sick day knowledge and what you need to be doing. Cassie gave you some really great information about things to keep in your dorm room in case you do have a sick day, and Whitney's gone over that information with you. I'd say, go out and buy that stuff and put that in a box to take with you to school, put it in a container, label it sick day, so that you've got it if you need it. Another thing that can be helpful, this is as a parent of 2 kids who've been through college, is that we found it was helpful for them to have a gift card that was specific to the pharmacy that they were going to be using at college. One of them got pneumonia and needed to go get antibiotic, and that they had their money for their antibiotic. So you might think about something like that. And if you want to have your prescriptions both at home and at school, you can do that. Please let us know far in advance if you need a paper copy of things to take with you. But if you're using something like CVS or Walgreens or Walmart, they're able to kind of transfer your prescription back and forth from one city to another. So that can make it really easy. So that's worth thinking about. Does anybody have any questions about COVID-19 before we go on? I can't see the chat, Whitney, so if you'll let me know.
Yep, I don't see anything yet. And I did try to change permission, so you may now have the choice to unmute if you didn't previously. Okay. I think we could keep going, and then if we see anything in the chat, we can catch it at the end.
All right. I wanted to talk a little bit about stomach flu because, well, 2 things. One is that a lot of times people will be really disappointed. They get the influenza vaccine, and then, later that winter, 2-3 months later, they've got stomach flu. Stomach flu is what we call gastroenteritis, and gastroenteritis is not prevented by the influenza vaccine. So it's a completely different virus from it. The other thing I wanted you to know is that ketones and ketoacidosis can look like stomach flu. And a lot of times when we're on call on the weekends, whether, Dr. Lowell or Dr. Zevin or I, or, whoever's taking the calls, somebody will call and say they have stomach flu. What they really have is ketones and vomiting. You get nausea with it. You got abdominal pain. You can, throw up a lot with it. Stomach flu is different. Stomach flu has ketones and vomiting, but it also has fever and diarrhea with it. So if you wake up and you're throwing up and you've, got ketones, it may be that you've got some other illness, getting started. It might be that your pump isn't working. That's always the first thing to think of, is that the pump malfunctioning is number one. Or it might be that you fell asleep and you were studying and you fell asleep and forgot to take Lantus. And so you didn't have any long-acting insulin overnight. So think about, sort it out a little bit. Do you have fever? Do you have diarrhea? If you don't, then it's probably more like the pump not working or the Lantus being missed. Ketones and vomiting are in both of those illnesses. Any questions about that? Okay, then I'll move on to something that's, one more thing, and then we'll talk about something that's kind of fun. Occasionally you might get sick and have a normal blood glucose. I know that most of the time when you're sick, your blood sugar is going to be high from all the stress hormones that are part of the illness. But occasionally someone will have a normal blood glucose or even a low one. But if you've got ketones, no matter what your blood glucose is, it means you need more insulin. And so you've got to check urine ketones. If you are sick, if you feel nauseated or you have fever, or you've got a bad cough, you need to check your ketones even if the blood sugar is perfect. I remember we started this class about 20 years ago at the recommendation of a college student who developed ketoacidosis. He had a stomach flu and his blood sugars were going low instead of high, so he turned off his insulin pump and called his mother, which is always the right thing to do. And she recognized what was going on and sent him into the ER. So if you've got an illness, even if the blood sugar is perfect, you could still have ketones. So check the ketones. If your blood sugar is low or normal, we'll try to see if you can drink things like Gatorade, like a tablespoon of Gatorade every 30 minutes or so to get your blood sugar up enough so that we can give you some more insulin to clear out the ketones. If you can't do that, then what we do is have you go into the ER and get some IV fluid for a couple of hours, and then hopefully you could go home after that. So when in doubt, if you think you're sick, check your ketones no matter what the blood sugar is. Now, some fun part. I hope that when we see you next summer, that some of you will be planning for a semester abroad. For some of you, it might actually be that you're going to actually get to be in the dorm finally after, maybe being home for a semester or two. But if you're thinking about a semester abroad, get us involved as early as possible. Our nursing staff and our physicians have helped lots of people do this. And we've also gained good information from people like John Beckman who have brought back additional tips that we didn't know when they've done it. It's really something that it expands your world, and it is a wonderful opportunity to also see, how things are done at other universities in other parts of the world. The other thing is it's going to be cheaper for you to do that as a college student than it will ever be for you to travel anywhere again. So that's certainly worth thinking about. A couple of things to do. One is to notify the diabetes team so we can give you some ideas about how to transport your insulin. Another one is to look on the CDC website and see if you need any immunizations to go to the particular country you're going to. Right now, we really don't usually need anything to go to Europe, but that may change, if there's a vaccine for COVID. If you're using an insulin pump, look into renting a spare one for the semester that you're away. The pump companies will usually do that. They charge a small fee, but not nearly what you'd think they might charge. Last time I checked, it was about $50. The other thing is to talk with your pharmacy and your insurance company, because they all have contingency plans for dispensing more than a month of supplies at a time if someone's going to be traveling out of the country. If you're going to be gone for 6 months, maybe you want to have your parents come visit you in Spain so that they can bring some supplies for the last 3 months. If you're going to be there for a year, you should really work on figuring out how you're going to get things. We don't usually recommend getting the bulk of your supplies from Europe or from any other part of the world, because they have other strengths of insulin besides the U100 used in the United States. And some of the markings and some of the other supplies that you're accustomed to may not be available. So you just want to take those things with you. There's also a travel guide that's put out by the American Diabetes Association. There have been at least 2 editions of it. There are a lot of other good materials now available on the internet to talk about things that make it easier to travel, and finding cool packs that will keep your insulin at the desired temperature for 48 hours. It's good to know where the U.S. consulate is in whatever country that you'll be traveling in case you had something weird happen. We once had somebody who needed to have surgery, and so it was good to to have some contacts going back and forth between Australia and the United States when that was going on. Check your phone plan, particularly if you're on your parents' phone plan. Make sure that it's going to be economical and possible for you to be texting them or to be calling them while you're there. And if you do find that you're going to need any vaccinations, most HMOs authorize visits with an international travel clinic. I know of at least 2 of them in Madison. So that's something you might want to look into if you do need vaccines, having looked at the CDC website to see what vaccines you need. So I'm glad to take any questions. I hope your first semester is wonderful. It's going to be unique. Nobody else will have a story like yours to tell. And we'll look forward to seeing you guys, whether in video visits or in person, when you're home on winter break. So congratulations, and on with the panel, I think. Whitney may have.
Yeah, just one question, Ellen, that's come up so far was someone asked, so based on what you said, do you consider it reasonable for kids to live in the dorms?
Yes. Yes. I would say it's reasonable to live in the dorm as long as they have good hygiene. The dormitories are all going to have procedures to decrease how close the contact is. The universities that are allowing in-person stays have worked out procedures where if a student did develop COVID, that they would actually be in a different location. So you wouldn't have, for example, your roommate coming back with COVID and you having to live with them while they're recovering from that. I think that right now we know that if you're in good control, that you're not at an increased risk of getting it. And if you're using the same good hand hygiene and really paying attention to the masking, and observing the physical distancing, that's reasonable. So yeah, I wouldn't say that everybody needs to stay home this semester. I also, for those of you who are going on campus, be prepared that it's possible that your school may need to change. If they have a certain number of students who are infected, they might need to send more, to change the semester to being more online, or change some of your classes to being more online. So, it's also important to realize that you may get there and be there for a few months and then they, end in November instead of December or something like that. Any other questions?
Yeah, any other questions?
I'm glad somebody asked that. I was going to mention that, but I forgot.
All right, so
okay, myself.
I'm just going to stop recording now because we're not going to share this portion of the presentation.